it's very important that, especially working in a community health center, that we see all patients regardless of their ability to pay and regardless of their circumstance, their health circumstance. So it's important that we show compassion to our patients so that we can better understand their circumstance and their situation. But then we also have to meet them where they are and set goals with the person. And that's the accountability piece. So once the person has established what they're trying to accomplish, then we help them set that as a goal and then hold them accountable to that. So we work with them to reminders and to encourage them through that process. So I call it the balancing scales of compassion and accountability, where you can't be all compassionate and let people just get away with things, and you can't be all about accountability and hitting them over the head with a hammer because they didn't do what they were supposed to do. It's a fine balancing act between the two. And that way we're able to show our patients that we care about them and we're working with them to accomplish their goals they've set for themselves. Statistics applies to a large group of people. They don't apply to individuals. So when I'm working with families and we talk about, well, your risk of getting this health condition or your risk of having a poor outcome might be this, I make sure that I let every single patient understand that that is when we look at a large group of people. It doesn't apply to them as an individual because they can do the best to try to minimize those statistics, the negative statistics. Yes, I grew up in this community. This is the same zip code where I grew up in, right, Port Washington, the capital. Went to Milwaukee public schools throughout, and what made myself and my brothers really be able to continue to achieve our goals is having a very strong two-parent family, work with us, make sure that we stay out of trouble, you work hard, you do the best you can, and by doing the best you can, whatever the outcomes, then that's what we're pleased with. But you always have to try to do your best. That inner cities throughout the United States are health profession shortage areas. And that is by definition meaning that there's a shortage of physicians who work in those particular areas. So it's not rare, but it actually obviously is less than what you would get in a non-health profession shortage area. So the reason why I call myself an inner city doctor is mainly because I want people to understand what I'm trying to do. This is my mission. This is my passion. But along with that passion or compassion, in this case, is the accountability. Yes, there are certain situations, illnesses, conditions that we have to deal with. We take a holistic approach. We're not just looking at their health condition, but we also are looking at what are the other social factors, economic factors, spiritual components that may go into their health and wellness, and we work with the person holistically to try to set some goals. So an inner city doctor really considers all of the components that's going on with a person's life, not just their health.